my name is JC Fields. This is IV insertion with Pete's Lab. Okay, so the first thing I'm going to do is I'm going to make sure that I have an order for an IV. So once I've done that, I'm going to gather all my supplies. I'm going to knock on the patient's room and enter, perform hand hygiene. I'm going to place them in a comfortable position and explain the procedure. So once all of that is done, we can move on to our fluids. So right here, I have our fluids already set up, and I have my name, the patient's name, initials, the date and the time, the start of the infusion, the end of the infusion, and the rate at which it is infused over. So we have all that documentation already done. Also on our tubing, we have my initials, the date, and the time. So we already primed this up, so I squeezed some into the drip chamber by opening up the clamp, and then we just kind of inverted our ports and flicked them to make sure that all the air is out, and you can see that in my priming IV tubing video a little bit better. So now that we have all of our tubing set up and we checked expiration dates and to make sure there's no particles floating around or discoloration and it's the right fluid, then we can begin to check for vein. We did our 3 checks and our 6 writes already. So now I'm just applying the tourniquet to the patient's arm. This will go about 4 to 6 inches above kind of where we think we're gonna go. So I'm just gonna palpate a little bit. If I can't feel the vein, I'll take my gloves off and then re-glove up before starting. But I feel the vein right here, so I think we're good. I'm checking for bounding pulse, radial pulse, and then rebound. Okay, so we have our site here. This is our aseptic stuff. So I'm gonna scrub the site with friction for at least 30 seconds. So 30 seconds to a minute is good. We can go vertical, we can go horizontal and circular. We're gonna wanna go the whole placement of the IV and the securement is going to be washed. So it's a pretty big surface there. Okay, so we did that for 30 seconds. Now here I'm going to be pulling the skin taut with my non-dominant hand. Now here I have my dominant hand, so I'm just going to flip off that protective covering with the bevel up. I will begin to insert at a 30 to 45 degree angle. So I inserted just a little bit. Now I'm going to stop. I'm looking for backflow to fill up in my chamber right now. So I see my backflow of blood filling up. So I'm going to go ahead and advance about another 2 inches. So we got that. Now I'm just going to take my finger and I'm going to start to advance the catheter in to the vein while retracting the needle. So I'm going to place my thumb here and my finger above where that catheter is. And this is going to help with the flow of the blood. So needle's going to go straight to sharps here. I'm going to hurry up and connect this. Again, nothing is left unsecure. We're going to screw this all the way in. Usually we'd have extension tubing, but I didn't have any, so we're working with the primary. Okay, so I am going to apply some tape here to help further secure my catheter before letting go. Okay, so now that it's pretty secure, I'm going to let go of the tourniquet. So pop that off. Okay, so now I'm going to flush with my saline. And doing this, what I am checking for is any redness, swelling around it that gives me an indication that the fluid is going into the tissues instead of the vein. Also any pain that the patient is experiencing. Okay, so this IV is patent and we're good to go with further securing the IV. I'm not sure what this tape is here. I'm gonna move it to the side. Okay, so further securing. I'm gonna place the sticky side up and we're gonna gonna kind of go in here. And now we can just kind of do like a little crisscross. So crossing that there and crossing it here. I'm gonna grab my Tegaderm here. This will go over our hub, but not the other little junction. We can pull this off. I'm gonna pinch around the hub here. And then also initials, date, and gauge will be on the site. So I have my little label here. And we're gonna say that this is labeled with my initials, the date, and the gauge. So that will go on the site. Now that we have everything pretty secure here, I'm gonna just kind of further secure the tubing just to ensure that my patient doesn't knock it out and we have to restart, because IVs are pretty traumatic for some people. Okay, so now this is kind of what my site looks like. If you can zoom in on that or get a close up. Okay, so then I will furthermore check for any redness or anything going wrong with the IV that indicates that we need to restart. Everything looks good, so I'm going to clean up my supplies. I'll take my gloves off, perform hand hygiene, and then I'll exit the patient's room and document. Now we are going to discontinue. So with discontinuing, we're going to make sure that we close our clamps, and we are going to walk into the patient's room. We're going to explain procedure, perform hand hygiene, and put on gloves. So I had one of my clinical instructors tell me a good tip, and she said that instead of using a whole bunch of these little alcohol swabs, if you use the alcohol hand sanitizer, the kind of foam, and just kind of rub that all over the site, then it is easy to get at that stickiness, and it's not as painful for the patient, especially if it's a man and they have a lot of arm hair. But for this video, we'll use the alcohol swab. Okay, so we're swabbing, and we're just kind of breaking up that stickiness and all that tape, because we're gonna try to get, we're gonna want to get the tape off of there without ripping out that catheter inside the patient. So right now I'm just getting all the tape off, trying to be careful not to rip out the catheter out of the patient. So I'm just working my way around.
Mr. Potato Head don't look that healthy.
Okay, so now we have all of this out, tape out, and our catheter is still in, as you can see. So now that we're at this point, we're gonna grab our gauze. We're going to place it here, but I'm not putting pressure on it until I take out our catheter. So we're retracting the catheter in a fast, slow movement. Now I'm pressing pressure down on this to stop blood from flowing everywhere. So then at this point, my patient can just kind of hold it for a second and then throw it in the trash, or we can go ahead and tape it down. I don't have a great piece of tape here, but tape it down. And then that is discontinuing the IV, so I'll get rid of all supplies, wash my hands, and then document.